Hi, I'm Kat and I am here at Paragon Vein Care to have my varicose vein procedure. I'm very excited about it because over the years it's gotten a little bit more pronounced on my leg. About 5 years ago, started noticing a varicose vein on my right leg. And it was a very small vein that was starting to pop out, and I really didn't know what it was. And I noticed that over time it started to progress. It went up my thigh, started getting a little bit more pronounced, a little bit lower around my knee area, and protruding a little bit. It would also bother me. I found that I unconsciously would start scratching it. And it had a little bit of an itch to it, especially if I was standing up for long periods of time. It just started to irritate me, and it was also unsightly. And especially with the warm weather, I wanted to be able to wear shorts and a skirt and not have this vein on my leg. So I came here, I got to talk to Dr. Schmidt, and he was wonderful. He told me exactly what was going to happen. So I came in with the nurse, and she did a sonogram of sort to take a look at the blood flow, and that was very fascinating. And she was great because she told me exactly what was happening and why the blood was flowing in different directions. It was really fascinating. And then Dr. Schmidt came in, and he told me exactly what they were going to do, really from start to finish. So he really alleviated any of my fears that this would be a complicated procedure. He said it can be done within an hour. Once that, I just will have my leg wrapped up, a few days of wearing a compression stocking, and then I will be good to go, which was really a wonderful thing to hear. So Dr. Schmidt handed me off to his scheduler, and she was great because she scheduled all of the appointments that I needed, from the actual procedure to the follow-up, to what happens in terms of insurance, getting pre-approved, which she was able to do after my very first appointment. So I knew exactly what the cost was from my side and what the insurance was taking care of. So that was a really nice thing to have that all laid out in advance. So I knew what my commitment was in terms of time. I knew how long I needed to have compression stockings on. I knew how long the appointment was going to be. So I am here today to get my procedure done.